Gather around, one and all, as we go high-tech on Explore Tulsa.
That's right, Stevie. The world of medical treatment is constantly changing. And right here in Tulsa, some of the most advanced procedures take place every week.
At the Oklahoma Heart Institute, there's a new heart valve replacement process that is really changing patients' lives. If you like, I can break it down for you, give you all the surgical details.
You know, why don't we call Dr. Muhammad? I think he has a little more experience than you do, Stevie.
I think what fascinated me about the heart is that it is a very mechanical structure, and it has rules by and large, and so you can understand it in a very concrete way. And what that means is that you can do things or learn how to do things to fix it if things go wrong. So it's a very understandable and mechanical organ in the body, unlike other organs. And those properties allow us to really study it and understand it and develop technologies to fix it when things go wrong. The heart has a lot of different parts to it. So, you know, it's a muscle. The heart is a muscle, and what its job is to supply oxygen-rich blood to all the organs of the body, which depend on that blood. So in order to accomplish that task, the heart itself has to function normally, and the heart itself needs blood, and the heart has valves that control the flow of blood in the heart so that it goes in an orderly fashion through the chambers of the heart. And then the heart has an electrical system which helps activate it so that it beats regularly. You know, the thing that we have focused on with transcatheter aortic valve replacement is fixing the aortic valve, which is the main outflow valve of the heart, which also happens to be one of the main valvular conditions in the United States. And so that's what transcatheter aortic valve replacement does, is it allows us to replace that bad heart valve, the aortic valve, but it allows us to do it in a way that avoids open heart surgery, which has been really the only way to fix valve problems for the last 30 years. Tulsa had the technology available in May of 2012 when Oklahoma Heart Institute implanted the first such valve in the city in May of 2012. And since then, you know, we've implanted more than 100 such valves, and the technology has taken off worldwide. There are more than 150,000 such implants worldwide over the last, you know, decade and a half. And a lot has changed in 15 years since the proof of concept was done. And you know, I think it'll continue to expand. I think the area of valve therapy in general is expanding, is being revolutionized by this technology. We're seeing more and more patients treated with this rather than open heart surgery. And you know, like I said, before 4 or 5 years, open heart surgery was the only way that most people could get a new valve. And that's changing a lot and will continue to change. Well, I think it's really, really rewarding because, you know, these patients are so kind and nice, and they are so just wanting to have a normal life and not be short of breath and to be with their loved ones and do whatever it is they like to do. So it's really rewarding, and I think it's particularly rewarding because the procedure is so non-invasive. We do a procedure that takes an hour, hour and a half, and they're up out of bed later that day, walking the next day out of the hospital, generally by day 2 after their procedure. So we've taken someone who's quite elderly and frail and put them through a very generally safe and simple procedure, not a very taxing procedure. In fact, we just celebrated yesterday evening, we had a gathering of patients to celebrate, you know, the milestone of having done 100 of these procedures at Oklahoma Heart over the last 2 years roughly. We completed 100 procedures in July. So we had a get-together and we invited a number of patients, and they came with their families, and they each, you know, several of them told their stories, and just to see them, you know, in their element, so just to see that they're well enough to do that and enjoy themselves, I think it's very rewarding.